So look at another pregnancy emergency. This is what is known as what? Uterine rupture. So this is the uterus of the woman. Let me describe it so that you understand. This is the vagina. This is the cervix. Alright. This is the uterus where the baby implants. So if the uterus is tearing up, that's what they call uterine rupture. Alright. Now you might want to even be wondering, like, how does something like this even happen in the first place? Yes, it can happen. So it's a rare, but it's a life-threatening obstetric emergency. This is where the muscular walls of the uterus, they tear during pregnancy, normal pregnancy, or sometimes during labor, when the mother is push. The uterine walls can actually tear up. So it's most commonly in women attempting a vaginal birth after cesarean. So maybe they try to do some cesarean section and there was some 1 or 2 complications, but they already incised you. Do you understand? Or sometimes, okay, what they mean is this: you are trying vaginal birth, but the previous time you gave birth, it was cesarean section, so you still have a scar line of the previous cesarean section. So your abdomen is kind of like weak, especially if it was not done well. So all those push, something can just rupture up, So what is uterine rupture? It's a tear in the uterine wall, potentially extending along through all the layers, or only some. It can be complete rupture, can be some. Can result in the fetus, placenta, or amniotic fluid spilling into the abdominal cavity. Now see, the abdomen has many things, but many organs in the abdomen, they contain their fluid and it doesn't spill into the environment. Now God knows why he made organs to confine those fluids. If something is spilling into another thing, so it requires immediate surgical intervention to prevent severe complications for both the mother and the baby. So signs and symptoms is a sudden or severe abdominal pain that persists between contractions, abnormal heart rate, the baby is the mother is bleeding, vaginal bleeding, loss of uterine tone or change in uterine shape, maternal shock, cessation of contractions, palpable fetal paths through the abdominal wall. Right, you see that. So risk factors: if the mother has previously had a cesarean section, so she has a line that is weak, uterine surgery, she has had surgeries in her uterus before. Labor induction, maybe they use some drugs to now make the contraction so much, obstructed labor, multiple pregnancy, you have twins or more, high parity, she has given birth so many times, trauma, she has had accidents before that are affected her place. So diagnosis is just clinical suspicion, alright, the doctor will suspect it based on those symptoms I mentioned. He has seen them in you. Fetal monitoring showing distress or absent heart tones. Ultrasound may show, but it's not always definitive. Often confirmed intraoperatively during maybe emergency cesarean section. Okay, so that's just it. So that's just it for the concept of uterine rupture.